take you through the adult safeguarding portal demonstration. Today has been designed particularly for people who will be sending in what we call community referrals. That's professionals, organizations, services, but particularly organizations and services who will be sending what we call community referrals. It's where you're worried about somebody, where you're worried about somebody's welfare, their safety and protection, and you want to contact the HSE safeguarding teams through our portal. Just an important point before I hand you over to Marguerite, all our safeguarding teams have direct phone numbers, and HSE safeguarding.ie forward slash safeguarding, and we will put that up at the end, which will give you the contact phone numbers. So there's also ways of contacting social workers directly through our duty social work. But really today is about our ICT system. We have a portal way that from next week you can contact HSE safeguarding and protection teams directly and to submit what we call community referrals. We want to walk you through what that is, how you log on, how you create an account, and how you submit your concern to us. And there will be time at the end for any questions you have or queries around how the submissions work that you send in to us by portal. For those of you that are used to using portals, maybe through TUSLA or other organisations, you will have some previous experience. However, this may be the first time some services or organisations or community groups will be using a portal to send community referrals directly into the HSE. So I'm now going to hand you over to my colleague, Marguerite Clancy.
Good morning, everybody. As Tim mentioned, I work here in the National Safeguarding Office, and I've been involved in this, the rollout of both the portal and the online system for adult safeguarding, which is the system that the portal feeds in terms of our safeguarding and protection teams. I'm just going to share a short presentation with you, and then from that we will move to discuss the actual use of the portal. So just as a starting point, just to give you a small bit of background, in terms of what we're going to discuss today, this process of communicating referrals into our safeguarding teams has been defined by a policy, and that policy that's in place since 2014, so that's the Safeguarding Vulnerable Persons at Risk of Abuse. And some of you may be aware that there's also been a publication of Moving Forward Adult Safeguarding in the Health Service Executive this year. So there's potential as that newer policy, as that newer document is implemented, that there could be changes in the way we all operate. But as things stand, we're working to the 2014 policy, and that's what we're going to be discussing today. So the system that has been designed, it's based on the as is. So you will see, for those of you who are HSE employees, you will see that the structure of the referral system is based on the CHO structure. So that's the community healthcare organisations, the way the HSE is defined. For those of you who are non-HSE, when you go on the portal, it'll actually define those areas, and that'll enable you to make an appropriate referral through the appropriate pathway into the correct team. So over time, that this is going to evolve, and potentially that, as the HSE structures are implemented, this will change. But this will all be notified in due time. Just to notify, if anyone has questions as we're going through the process, there's the ability to put some comments into the comment box there, and we will deal with them at the end. In terms of the system, the provider of the system is Liquid Logic, and they're a UK-based company, and they've recently been acquired by System C, which is a much larger organization and company that have, I suppose, many products in place, both in health and social care. In terms of the safeguarding market, they have almost over half of the safeguarding case management systems that are in place in the UK. So the components of the system, we're going to speak around the adult safeguarding portal today, but just to mention that this, the adult safeguarding portal is both for members of the public, it is for people today who are coming on reporting in a professional capacity. And then there's a separate channel for our HSE and HSE funded services who have a specific requirement under the policy to submit preliminary screening forms. So that pathway, that services pathway, is specific to those. So as I said, those who have a responsibility to submit preliminary screening forms, who have designated officers in place. So I suppose the group that we're speaking to today is specifically our professionals, both health and in the wider context of society, both, members, it could be An Garda Síochána, Department of Social Protection, it could be HIQA, all of those can come on and make a referral in via the portal, through the professional route. And all of these portal referrals is a more streamlined way to feed into the online system for adult safeguarding, which is what our teams are using, and that is a full case management solution for our teams. Okay, so that just provides some context. Why we're changing, first of all, I suppose there was a requirement to have a secure national system. Our teams have been working, so we have 9 teams across the country, and they're working within their specific areas, and they have different approaches in how information was fed into them through, I suppose, email and share file systems. So what we have now is a secure national system, a portal that has dual factor authentication. So once I speak through this, once you have an account, there's a code that's issued to you for each time you log into the service or to the portal, and that is a very secure way to keep the information that you are providing to our safeguarding teams very secure. Um, it's a cloud-based solution, so that reduces the risk of any cyber attacks. It's based in, it's secure in Azure, and as I said, that all helps in the security. In terms of enhanced reporting, I suppose the capability to be able to report on all information that is captured within the submissions to our services, it further informs the nature of the concerns that come into us, the complexity of them, the range of people who are reporting in, and that's something that's constantly building over time, and the portal will see enhancements over time as we try and widen that. And in terms of it's the provision of a very standardized, a safer communication between both our HSE and HSE funded services and also our wider interagency referral network. We've tried to include some standardizations, for example, air code, the ability to, date of births, the ability to be able to, if you're submitting from a day service and don't have a designated officer and are submitting through this route, that you would use the day service ID, all of these to help in the standardization of the information and the ability to be able to report more reliably on the concerns that we get referred. It's a very client-centered approach. So the basis of the system is that when concerns are received in, there is a search from the team's perspective that they can search that person and be able to align it to any previous referrals that have been made in relation to an individual. So again, leading into the national, when you search, you search that person on a national basis. And there's also the unique health identifier, the IHI, has been incorporated into the online system for adult safeguarding. Again, trying to make enhance the information and the security of the information that we are containing. In terms of the workflow, I just think it's important to say from the outset that today's referral is today's webinar is very much just to focus on the public or professional referrals. These are referrals that normally would have been logged as a safeguarding concern, a community concern, and would have come into our team for the team then to decide if there was a safeguarding concern, and if there was, progress that through the team managing the concern from there on. So that's what we're replicating today in the discussions. I just need to reiterate, if you are a service that normally submits a preliminary screening form, I need to state that we have a webinar next week, and that will be the focus of the work that you are doing. So this is specifically for public or professionals that are logging a concern. So in this new process, it's going to log on via the portal, and then it's the team, then it'll come into their duty social work for a decision to be made, and then whether that is deemed to be taken on by the team and managed thereon. This gives you just an overview of what the actual portal looks like. So there is 3 different tabs. You've got reporting a concern, safeguarding information, advice and contact, and then some portal help and support. So specific we're going to look at reporting a concern. But if you do want to look at safeguarding information and guidance, that brings you to information on our teams, on some training guidance, and some information on safeguarding vulnerable adults. So just to state, I suppose our teams are still available to you, and if you need to request some advice and guidance, you can contact our teams directly prior to making a referral on the portal. In terms of reporting a safeguarding concern, and if we're going down through that route, there is 3 pathways that are open to you. The public, if you're like a member of the public; professional, as I stated previously, if you are either a health and social care professional, or if you are acting in a professional capacity in the wider context within society, you can come on via the professional route. The HSE and HSE funded services, this specifically relates to those who are completing preliminary screening forms under the policy and have designated officers in place. So when you log in for the first time, in terms of the registration, because I've got a prior account, I'm just going to talk through this process, and then I will actually log in with my registered account and proceed from there. So in order to register for the first time, you will click that you're registered for a new user. From that, you'll be asked to provide some specific information. So your forename, surname, and your address. You can see there the red asterisk fields. They are the mandatory fields. I would request that if you're using the portal in a professional capacity, that the address that you use is your work address. So once you've completed all of these and you have ticked that the account is being used in a professional capacity, you move then to providing your email address. Again, it is your work email address that you would be using at this stage. For demo purposes today, I'm going to be using a Gmail account, but that wouldn't be typical. That's just because of my HSE account is used for administrative purposes within the system. So what I would be saying is you would be using your work account here and your work email address, and the password that you provide needs to comply with the password policy. And you can see there on the right hand side that it must be at least 8 characters, contain at least 1 letter. It must have at least 1 special character. There's, I suppose, normal password guidance that's provided there. And then you move on to next. And this is something that happens consistently within the system when you register and you log in with each time when you log into the system, you're actually provided with a unique code. So that code is provided to your the email address that you've provided. And you need to input that code, and you need to then proceed. Just to note that those codes usually come in very quickly. What we have noticed through training is that for HSE accounts, there may be a slight delay. It could just be a couple of minutes, and that just relates more to the firewalls that exist on the HSE side as opposed to an issue with the portal. Certainly when we use it outside of the HSE domain, we seem to get the codes quicker, but you will get a code within a couple of minutes. And if there is ever an issue that you don't get that code within 5 minutes, you can please send a new code and that will be issued. Okay. So from here on, I'm actually going to click into the adult safeguarding portal, and I'm actually going to now be able to show you the functionality using my live account. Okay. Carol, can I just confirm that you can see that?
We can, Margaret, we can see the register a new account step 3. We don't, that's all
okay.
I can
Okay,
see.
I'm just going to have to escape. I'm just going to have to reshare. Now, are you seeing the portal?
Yes, Ken. No, yes, I can. Sorry, apologies. Yeah.
Okay. So this time, I'm just going to show you as a registered user. Okay, so I'm going in here. I've got the public professional HSE funded. I'm going through the professional route. First item I'm asked, I can select a route that I'm going to take. So this is what I'm saying about it being CHO based. So if I pick that I am selecting CHO 1 or 2 or 3, it'll be that specific team that you're sending it through to. So if I select CHO 4, the first details I'm given is how the portal works. So you're asked to proceed through the portal using the next and back arrows. That if you see a red symbol, that means a mandatory field that you can save for later. So at any stage during the process, you can save and then return to it at any time. And any saved forms will remain within your saved forms for 30 days. There's also the ability to be able to print a form and be able to view it in PDF. And I'll talk through that process as we go through. So here I'm now being asked straight off to log in or register. So I'm going to click in log in or register, and I'm going to put in my details. And the code is being requested. Just waiting for a moment for the code to come in, and once that does, then I will enter, and then I'll be able to my details. So my code is being received. Yeah. So the first details that will appear on screen is your details. So they are the details that you would have provided when you registered on the first occasion. So they will be your work address and your email. So in terms of a source of contact, so in today's example, I am going to say that I am a public health nurse and I'm making a referral. Okay, so the first name of the client is Brian Mullins. What I would say to you is, in relation to date of birth, it is beneficial from a service from the safeguarding protection team perspective and in making IHI matches on individuals that it is more beneficial if we have the date of birth. So we would urge professionals to provide this information. If this information is not available to you, you have the ability to be able to provide an age. But ideally, we would request that our professionals would provide a date of birth because, as I said, this makes the matching. This is essential, I suppose, in the matching of clients within the IHI process. So once the date of birth is provided, you can see that the age is grayed out. So it's either one or the other, but I would urge you to complete and provide that date of birth. So gender Again, in relation to the address, air code here is indicated as a mandatory field. We would urge you, where possible, to provide the air code of where the person, the adult at risk of abuse, is living. Because again, this facilitates matches and accurate matches within the system. So once you input that, you can go find address. And that facilitates this information feeding in. I'm just going to show you if, for example, if you did encounter some challenge in relation to air code, you have the ability to be able to enter address and put in the fields. Okay. But we would urge you, as I said, to provide as much information to our safeguarding teams as possible. So in terms of the type of type of service, this is a primary care. So I'm just going to put it in under PHN. These we will be rectifying or modifying types of service over time. So bear with us on classifications. Does anyone live with the adult at risk of abuse? In this case, yes, and we're going to say it's an adult daughter. And we can provide then the reasons for contact. So this is very important, and that's why the red field is there on mandatory information. So please provide as much information as possible. I'm just going to carry forward those fields just to save on time, and then want to provide brief description of the adult at risk. So you can provide as much information into this that will feed into the team, so as much detail as you can. And then you can provide any details on if there is communication needs within this field. Are other services involved? So you can, if you say yes, and then you can say that there's PHN and home care being provided, and you might say that who the agency involved in the home care is. Okay, and then you proceed. So you have the ability at any stage to save for later. And if you save that for later, it will go into your saved forms and they will remain for 30 days. So I'm going to just progress to next. So it's asking then for the date the safeguarding concern. You've got the ability here to tick into your calendar, and you can select that this arose yesterday. You indicate the type of abuse. You can say the location. So in this case, it's actually own home. And is the adult at risk of abuse aware that the concern is being raised? Yes, in that you have spoken to them. And then you can provide some details. And who knows if the adult at risk is, what is known of the adult at risk of abuse's wishes, so you can document what their wishes are at this point. Is it deemed that there's ongoing risk? I can say there is, because, and you can provide rationale. If there's any capacity considerations, then these can be recorded here, and you can provide details, or else if there's no, then that field doesn't default. And then we need details, so of the person allegedly causing concern. So there's some guidance here on the provision of this information if you believe it's necessary to name the person allegedly causing concern on this referral form at this time. So we're going to say Jane Ryan. In this case, we don't have an address for Jane. She's female, and that she seems to be, she's a neighbour friend. And is the person aware that safeguarding has been made? Yes, they have been informed. And then, while these fields aren't mandatory, we would encourage that you would complete as much information as possible. And this again will help the team if they do need to make links to like Dr. Dr. John Ryan, and if we put in putting in all of the other details into those fields. If you save for later, your form has been saved and an email confirmation will be sent to you, just confirming that you have a saved form. And there'll also be a reminder that you have 30 days to submit that form. So if I close out of this and if I go to my saved, I'm just going to show you this, my saved forms. You can see Brian Mullins exists there now within the saved forms. So I have a saved form here since yesterday. So this will continue to count down. You also will receive an email to say that you have something within the saved forms. So that might be if you need to start a form and then you need to come back to it at a later stage to complete it. When you go back in, when you click on the saved form, it'll bring you back in and you can start and you can resume where you were working. Or potentially, if you need to, you can go back into any previous sections of the form. You've got the ability then to upload any supporting documentation if you require, and that's just through the usual processes for uploading a document. And you can attach that. There's also the ability to create a PDF at any stage, and if I click on that and OK it, create the PDF. You can see here that it appears in your downloads. So you can open that form. Is that showing for you?
Yes, Margaret.
Perfect. So this is just a copy. So there may be, you may need to hold a copy of a record on file. So that just shows you that there is that ability within the system. Okay. And then you proceed to next, and then you send the referral through to the team. Okay. Once it has been submitted, the information will appear in my submitted forms. Just takes a moment to arrive there, and it'll be in shortly. The submitted forms. You'll just note that there is this no response yet. Some of this, there's Brian Mullins. So when something has been received and is reviewed, that status gets changed. So that's the communication, and that is the process in terms of the submission of a safeguarding form. So that shows you're submitted. As I said, we have our saved. You can update your account details, and all of that information is there. Now, just to return back into, sorry, bear with me just one moment. Just going to go back into our Carol, I'm just going to go back into our presentation. Just bear with me.
Yeah, no problem.
Now, is the presentation available to you again?
Yes, we can see it.
Okay, perfect. So I suppose just a summary of kind of key points. In terms of the login onto the portal, so the portals are live and available to our professionals to use. What you need to do from the beginning is to create a portal account. Important to note, professionals who are reporting concerns, they need to use their work email and work address. Ensure that you have access to your email when you're creating this account, because a code will be issued to your email, and you will have to input that information in to be able to proceed. And the codes only have a short shelf life, so you need to do the process quite quickly. In terms of logging information, we need you to maximize the information that you make available. We encourage you on the use of date of births and air codes. If you are part of a disability day service and you click on that option and you are making a community referral, we encourage you to input the disability day service ID field, and that will be a drop-down field that's available to you. When you press return on that, it actually will default the name of your service. This is really, really important. We need you to provide as much information as possible to assist the team in terms of other professionals involved. Remember that you have the ability to be able to save a form in draft, and you can that information will be available to you for 30 days. You need to be able to all submitted forms, they're saved and they're available for 90 days, but we would encourage you to save a copy of what you submit locally, because we're conscious that you need to have records within your own service, because individuals, the security of this system is based on an individual making a referral in, but obviously as a collective unit you may need to have that information centrally located. You have the ability to download that PDF and be able to save locally. And there's a future functionality in the service, in this portal, that you also may see in the coming weeks, and that's the ability of teams. If information is submitted to us via the professional portal, and if there is some information that is that's not comprehensive enough, the team with this future functionality will have the ability to be able to send that back. And information, if a request is sent back like that to you, you will get a notification and you will be able to click on that task within, it's just above the submitted forms, and you'll be able to, it'll bring you to what needs to be completed. So everything, all of those requests will be within the portal, and that's, as I said, a future functionality. So just very conscious now of some questions that have come in, and I suppose the representation today is very broad, and we have people across many different community groups that are involved. So we will just endeavour to answer as many queries as possible.
Marguerite, can everybody hear me okay? It's Tim here. So thanks very much to Marguerite. You can all hear me okay?
Yeah.
Great, thanks Carol for that. So thanks Carol and Bridget from our office in the background. So we've had a couple of queries in, but just a couple of points, and I may go back to Marguerite on those. So the slides from today are available, and Carol has put up some details on the chat how we will circulate the slides, and the information from today is also being recorded with ISL interpretation. So this will be available on our webpage. I've also posted the link to the user guide for submit community referrals on OSAS, the online system for adult safeguarding, and I've posted that onto the web chat, so you'll see it there if you go in, both the guide for community referrals. When you go in there, there'll also be the guide for the people submitting preliminary screenings. That isn't the focus of today's webinar. So I think we've got a couple of specific questions then as well, if maybe we'll take them in sequence. Okay, so the first question is from Sandra. Is the portal live, and is there a cut-off point when the old ways of referring electronically to the regional email addresses will cease? I'll take that one, Marguerite, if that's okay. So in relation to that, the expectation across is that from next week, people will use and utilize the portal. We do recognize that some people may be challenged in terms of the transition. So we do have a 2-month transition period, but it's certainly on the community referrals. We think that the support, the advice, the guidance, the user guides are good enablers. And the communication that will go out will be that we would from next week utilize the portal. People can still phone the duty social worker still phone the regional, particularly as Marguerite made the point, for advice, guidance and support. That hasn't changed. So, if somebody is challenged about utilising electronic online system for adult safeguarding, so we do talk to your local safeguarding team or let us know. But the expectation is that from next week we will transition away from and cease using for community referrals. We expect professionals and organisations. We recognise that the public will still, people will still phone, and that's right and proper. People are still concerned about themselves or a family member, and that's why I've put up the contact details for the safeguarding teams. The phone is still a very important communication channel where people tell us their own story about something they're worried about for themselves, a family member, a friend or a neighbour. I think that there's a next question there. I think, yeah. So I think it's from Stephanie. Hi all, thanks for a great webinar. So there's 3 questions. Stephanie's got three for the price. One, which is great, who the data controller is of the portal. Okay, so and then there's a second question in relation to data sharing and data privacy, and the third then it confirms which services continue to submit safeguardings by email until the DSA are finalised and agree with services. Okay, so thanks for those questions, and I'll answer them each in sequence, and Marguerite can pop in. So there are 2. I think this question is probably more focused on people sending in preliminary screenings, which isn't the real focus of today. However, I will answer it. So those are the organisations where there is an oversight function with the HSE, and we will have a seminar and a webinar next Tuesday, and we will look at specifically the control of data that comes into the HSE that we then oversight. And I mean, that's where, so that isn't the particular focus of today's conference. But very briefly, what I will say is that if anybody's sending in a preliminary screening, which is they're an independent data controller, and the company is the data processor, which in this case is Liquid Logic System C. I will hold on the question around services in terms of the signing of the data sharing agreement, because I think it might add a level of complexity and confusion which isn't relevant today. And anybody, just to make this point very clear, anybody sending in a community referral does not need to sign a data sharing agreement with the HSE. It's a one-way submission of information that you're concerned about a person that you work with, a person you engage with. You could be a healthcare worker, you could be in an organisation, in a service, you could be a GP. You do not need to sign a data sharing agreement. We will come to those issues next week, and we are working closely with the representative bodies from the Disability Federation and from the National Federation of Fund. Any communication and a broadcast communication as will be issuing. Plus, we have also done what's called the frequently asked questions on data sharing, and a draft of that has been sent to all organisations and services. So, I've tried to answer that question as best I can, but it's a really relevant question. It's an important question, but probably is best answered through our webinar next week.
Yeah. And the next question David had, can a designated officer use the same email address if submitting a community referral? And yes, that is possible. But we obviously would, if DOs are completing in their professional capacity and they should be submitting a preliminary screening form, it's through that route. It's through the HSE and HSE funded services route that they should take, because the workflow thereafter is dictated by the route that something comes in. And the HSE and HSE funded is very different to the route for public and professional concerns, because they come into it. Public and professional are managed by the team, so they have a very different workflow. I know there's some questions there about DOs and member of a large service.
Yeah, Margaret, can I just one that was missed there? It's just from Mary regarding a community hospital with 2 DOs. Do we set up one account for the hospital or 2 separate accounts?
Again, if you're in a community hospital, you have a requirement to submit under the HSE and HSE funded services route. So if you have DOs, it stays, this route is not the one. It's the what Tim is mentioning about next Tuesday. That is the session for you. And also to state that each individual that's making submissions has to have an individual account. So it's auditable from beginning to end. So if you have two DOs, they need to have individual accounts. But I would urge you to say that today isn't the session; it's next Tuesday, because you would be submitting preliminary screening forms under the policy.
Yeah. Yeah, I might just pop in, and we recognise sometimes clarity on pathway can be a challenge. I know working through the services group in terms of preparedness for today, we did an outline of a memo for community organisations around how they can clarify that this is the correct pathway. And we mean here today sending in community referrals. As Marguerite said, if anybody is working in a HSE funded disability service or working in a where they have a designated officer and they're required to have a designated officer, or they work in a community hospital or a designated residential centre, then it's quite clear that they would be required to come under the full scope of the policy, have a designated officer, and come under the oversight, which we'll be covering next Tuesday. We'll continue to do broadcast emails to try and give as much explanation and much clarity around pathways. There's a couple more questions here. Just in terms of, there's a question here from, I think, the Huntington Disease Association. Are there plans to include people who self-neglect as a result of neurodegenerative disease within safeguarding? So I think this belongs to the wider work that's going on and led by Amanda Casey, the new chief social worker, in relation to the implementation of a report called the McElroy report. And there will be a clear focus on the pathways in responding to self-neglect. The clear message for now is continue to do what you're currently doing. The ICT project is replacing the old way of sending in hard copy community referrals, or as email attachments, or by shared file, with electronic, safe, secure system. Right. So we're not changing policy here. The issue around including things like self-neglect, and I think there is obviously a need to have greater clarity and certainty in relation to where the home for responding to concerns of self-neglect and how they're appropriately managed and work with people in those situations will be under the McElroy implementation plan. So it's a very important question, and it's one that will form part of the work programme. But it's probably not in scope of this particular project. This particular project is around a mechanism for a safe and secure way using a portal for people to notify. What I would say though is, if you're concerned, always send in a report. If you recognise someone is at risk of harm, we can have the conversations afterwards. If people around meeting criteria and everything, don't wait, don't be put off if you are concerned about somebody. Have we covered this already? I'm a DO from Ruben. I'm a DO managing a large number of managers over 5 counties in disability services. If any manager submits a PSF with a request for a formal safeguarding plan, come to me or the manager who submitted it. It is the former My Resource, may not allow me to send out. So in terms of that, again, we will be encompassed in our seminar that we are recording again next Tuesday. We have a recorded one up on our website, hse.ie/safeguarding, and there's a user guide. I've just submitted the user guide into the web chat. So today's focus, though some people may have come on today to hear about community referrals, and maybe some people would be still a bit unsure what pathway, do check with your local safeguarding team. But if you're working in a service that has a designated officer and you're required to have a designated officer, and you're a funded agency and your service agreement says you have to have a designated officer, it's very clear you're under the latter one, which is submitting a PSF, which we will cover in
next
detail
week.
on Tuesday, and it will be recorded as well. And there is a previous recording, and there is a user guide there. So I really want to kind of focus on what today was around people who operate in the community sector, healthcare workers in community health teams, people who would be, a member of a community organisation or a community service, public health nurse, a doctor, someone who's worried about somebody that they work with out there in the community and want to know, how do I safely, securely and easily submit that referral into the safeguarding team for their attention. So that was the focus of today. We do recognise that there are questions in relation to people who are oversighted. And as I said, we have a process there, and we'll have a further webinar, and the communication that's going out in relation to next week will encompass that. And we're doing some really detailed work with our service organisations through the preparedness work we're doing with the likes of DFI and the National Federation of Volunteer Service Providers to give us much clarity on that. I do recognise some people may have come on today and maybe submitting preliminary screens. So thanks for bearing with us today. But the focus of today has been on community referrals.
Just a query there. Can we log in from today to create an account? And yes, you can. The portal is available to you, and we have been receiving a small number of cases, in on that route, so it is available to you.
Yeah, we had intended to go live fully in September. We paused that for a number of reasons till next week. So the portal has remained. And as Marguerite said, a small number of community referrals have come in there and have spoken to the relevant teams, and they have been progressing fine. Similarly to if someone had sent in a hard copy or an email attachment, the communications all have the links with the details for the portal, and that's up on our web page, and it'll be included for those of you within the HSE in the broadcast email that goes out, and those of you external to the HSE, we will continue to circulate out through all the channels. And thanks to all the organisations that assisted us today in terms of our reach, and we'll continue to do this, and we may have other webinars into the future, and we certainly would look at maybe having other webinars for particular sectors out there in the community, because we want to maximise as much the people get in touch with us. Tomorrow is Adult Safeguarding Day, and we focus on financial abuse, and we know there's underreporting of abuse. We know that people sometimes don't recognise and sometimes are unsure where to go with a concern and are uncertain, is it abuse or is it harm? So what we want to do is have it as much and as many ways. So that's why the phone line and the contact details are still very important. People want to phone the safeguarding teams for advice, guidance and support. That remains and is a very important. We get well over 1,000 such calls every year, and it's really, really vital for the work of the safeguarding teams. Some people may want not to speak over the phone, and we want to make our public facing as user friendly as possible, and we will do further work around its accessibility, making sure that the language is user, but the really important point and why we've done this webinar, and we'll do further in areas, is the reach of the message. That people might be coming to this for the first time and thinking, oh gosh, I've recognized something that's an abusive behavior, that's financial abuse. We have with a very good foundation e-learning program on HSE land to assist people recognize. So much of today is about getting the message out, saying there is a portal, letting you know how to create an account, and sending that in to us. Okay, Marguerite, are there other, or Carol, are there other questions there that
question there
sorry,
about self-neglect, Tim? If referral is not accepted from a PHN like self-neglect, where is that referral sent or stored?
Okay, so again, I mean, the self-neglect issue is very important and it's very necessary. The ICT system will record all reports that come in. So I think that's more around how and what happens to that particular concern, and how that the engagement. We do recognise work has to be done on self-neglect, I think for anybody who's got a particular concern, do talk to your local safeguarding team. With some very good examples of interagency working or interdisciplinary co-working on self-neglect. It's something perhaps going forward we'll do a specific webinar on. But I think for today is the same message. If you're worried about someone, if you have a concern, do be proactive. If something does come back, sit down with your safeguarding team and look at that and see why or what would be the best avenue to progress it. I suppose we were mindful in the National Office that we're here as an enabler and to support people finding the avenues in the best way possible. Have that communication, have that contact, but referrals will come in and will be logged. But I think it's really important is the response. Okay.
There's just a query there. If there's just wondering if we take referrals or submissions from mental health professionals.
Again, I mean, it's a very broad question, and in many instances, the current policy, until we implement McElroy, is specific to older persons and disabilities. We will go forward with mental health, and our mental health colleagues are working on a very similar line and avenue and approach and philosophy as is encompassed in 2014 policy. So we may very well need the I suppose case coordinator, if there's a safeguarding issue, could very well be a member of the team in mental health or social work mental health, without knowing the specifics of whether that needs to be co-worked or still worked by the mental health team. What I will say is what I've said at all of our sessions: continue to do what you're doing in your local area. Continue to do the same, right? So just treat this as the electronic avenue for submitting referrals. What do you do today if you're in a mental health team? What's your relationship with between your mental health team and your safeguarding team in terms of the coordinating the response? And continue to do that until McElroy is implemented. And that was the message we gave at all the regional sessions. Continue to do what you're doing today. What we're putting in place now is an electronic way of sending in referrals. So it isn't replacing or implementing McElroy. That will happen over the coming months, and a timeline and a roadmap will be there for that. So continue to do what you're doing. Continue to talk to your safeguarding and who the appropriate person to coordinate the response. It may very well be the mental health team, or it may be co-worked with your safeguarding team. Is there another?
Just one question there, Tim. Will the existing plans transfer onto the portal?
Marguerite, I might ask her, Marguerite, to respond to that.
I don't understand in terms of plans. Again, that would seem like
safeguarding
that's a safeguarding plan. Again,
an open safeguarding plan.
Again, I don't think that's for today's meeting. It would be certainly for next week for the preliminary screening, when we're talking with our DOs next Tuesday. Certainly, if professionals through this process are involved with the safeguarding team, and they make a community referral, and then it is going to be managed by the team thereafter, they could be part of that care plan. So, the team would communicate in relation to that. But certainly in terms of the use of the portal, that wouldn't be something that would be communicated out via the portal.
Yeah, I suppose just to add to that, the portal is the channel for communication. Existing safeguarding plans, be a person in the community, an older person or a person with disabilities, or whatever living arrangement they continue. And that work is continuing. The teams have what Marguerite referred to earlier as a case management function, and they're uploading. That's not the portal. The portal is the communication. And what we're telling you and describing you today is the communication channel to submit community referrals. Safeguarding teams have a case management function, and current cases are continuing to be worked, as they always are. If they're open to the safeguarding team for managing a safeguarding plan, that is continuing as is, and they have the capacity then to move their safeguarding plan onto their case management function. I know people have lots of questions wider than sending, but that's fine. Is there a question there for Sandra? How will area public health nurse access the recording? Okay, so I think you've put up, Carol, that. Yeah, and certainly we're happy to do specific webinars for particular audiences. We've been in touch with a couple of the GP representative bodies in terms of doing a lunchtime or an evening one. We recognise these times may not particularly suit busy general practitioners and their practice nurses. Equally, we're happy to do one specifically for public health nurses. Could be, and again, we're really guided by the timing of that. I think, but we will probably have to do more specific webinars in the months ahead that look at particular sectors.
Yes, exactly. Because I'm just seeing there, Tim, a query in from Anne, who works with older people in their homes. And can I get clarity if we would classify this community in terms of registration and we would not have a professional registration? Yeah, we would 100% see you as coming through the professional route if you're working as a carer in the community. So it's that it doesn't require that you need a professional registration number, but it's that you're providing a service to a person and you're making a referral into the team in that capacity.
Yeah. Marguerite, there's a question in there for Aideen about creating a log-on account from today. So can she create a kind
Absolutely.
of? Yeah,
you can create, and while the promotion is from next week, there is the ability to be able to. The portal is available now. I suppose it's been widely promoted from next week, but it is available, so you can create your accounts at the moment. Yeah, there's no problem.
Where is the recording from today? It'll be up on our safeguarding.ie HSE.ie, keep jumbling my words, HSE.ie/safeguarding. We'll add it to there. I can give the link to the previous recordings before we finish, but we'll add to those.
And just to mention, just before we go, that Tim has mentioned that the teams are available for guidance and support. If there's any specific issues that you encounter with the use of the portal, that you can contact the safeguarding.socialcare at hse.ie. But we would encourage you to work through the use of the portal with your colleagues, and as I said, the functionality is there, and provide as much information as you can, because that will assist our team.
Yeah. We covered that query there from Anne, working with older people over 65. That was the one you covered. Just checking now, Carol, have anybody else? Okay, hi all. One there.
There's just one there, Tim. Sorry.
If as part of the organisational safeguarding policy, should the community referral form still remain in the policy if it has been moved away from this and it is going live via the portal?
Yeah, I think agencies obviously can look at their own localized policy. It has to be in line with the national Safeguarding Vulnerable Persons 2014 policy. If you have in there that the community referral form is in paper format, I would recommend it and advise you to update that now to reflect that the portal is the way to submit community referrals. People update their policies from time to time as things change, and certainly when the McElroy policy is implemented. Yeah, that one is a very good question, actually, because whilst we're not changing policy per se, what we are changing is the method of communication. As I said, the phone lines still remain open. and that's really important. However, from next week we have an expectation that people will use the portal as the avenue to sending in community referrals. So yeah, I would advise the organisations to look at their internal guidelines and their policy, and to make that point clear on any internal staffing training or guidance that you issue internally. Have we covered off? I think we've got. Okay, so can I thank Marguerite first of all for walking you through the online system for health safeguarding, the portal system for making community referrals. We hope it has been useful. We hope it has been informative. As I said, for those of you within the HSE, an internal broadcast will go through. For those of you externally, we will use all our channels that we're utilising to set up for today and otherwise in relation to communicating the message out on the portal. We know there will be further work. We will come back and we can do specific webinars for specific groups and specific, we'll target that. As I said, there might be particular community organisations, particular community health professionals such as GPs or public health nurses. We've pointed you to the guide for community referrals. The recordings will be up for today, and I hope it is clear as possible. Thanks in the background for Carol. Thanks very much for Amanda from who's done ISL interpretation, and also to Bridget. And thanks to you for your interest in that. We have a couple of hundred people who've come on today, so it just shows you the relevance, the importance. Tomorrow's Adult Safeguarding Day. I'd encourage everybody to look up if there's events in your area or activities in your area. Get involved, find out what's going on, promote the message of adult safeguarding. So from us in the National Safeguarding Office, thank you very much and goodbye. Take care.